Good morning, good afternoon, and good evening. Welcome to the 490th day of continuous consult of IFPH. Today, our guest is Dr. K.R. Janardhanan Nair, President of the Medical Assessment and Rating Board of Homeopathy, former Principal, National Homeopathy Research Institute in Mental Health, Kottayam. The topic of presentation is Relevance of Standardization of Homeopathic Education. We are lucky to have a person like Dr. Janardhanan Nair. On behalf of IFPH, I am once again welcoming you, sir. You can have the platform for the next 40 minutes. It's over to you, sir.
Good morning, good afternoon, and good evening to all of you. I am very happy and thankful to IFPH, the coordinators and members for being invited for this session. So the subject of importance given is the homeopathic education and its standardization. I would like to come to this point. Before that, once again, I miss to tell a very happy New Year to all our beloved friends. So happy New Year to all of you. It's a great beginning of a new year, 2022. We would like to have great changes in the field of homeopathy. And why I am telling likewise means I am holding the position of the President of Medical Assessment Board. And also I would like to tell that this National Commission for Homeopathy has been constituted recently only. Though the activities related to the Constitution and establishment of National Commission for Homeopathy was started about 1 year back. It was established on July 5th only, and July 5th evening, the Gazette notification came. Like in the case of allopathic medicine, National Medical Commission has been constituted. In Ayurveda, National Council for Indian Systems of Medicine, NCISM, has been constituted. And with equal importance, homeopathy also has constituted the National Commission for Homeopathy. The National Commission for Homeopathy has got a wide variation with the previous CCH. Previous CCH and later on, the CCH members were looking after the Central Council for Homeopathy. Then Board of Governors were looking after the homeopathy, and that was for a short period. And later on, the Commission has constituted. Commission has constituted with a wider perspectives and wider activities in its context, and with the 3 independent boards under this National Commission for Homeopathy. The first board is a Homeopathy Education Board. Homeopathy Education Board is constituted with the objective to look into the activities related to the rules and regulations of education, of research, of curriculum, and academic activities. This is the main area of activities with related to the educational board. And second important board is the Medical Assessment and Rating Board. And we are the persons to look into the quality of homeopathic education, the quality of homeopathic medical colleges, periodical assessment of the colleges, and issue of permission to the colleges. Every year, we want to conduct the inspections, and standard of the colleges has to be assessed, and permission has to be issued for all the homeopathic medical colleges. And rating means the quality has to be assessed, and periodical rating also has to be conducted. So likewise, that is a very, very core, important functional area of the homeopathic medical college that is being looked after by the Medical Assessment and Rating Board. Equally important, another body is that Homeopathic Registration and Ethics Board. Registration and Ethics Board, as we all know, after completion of the course, we are in the boundary of Ethics and Registration Board. We have to keep our ethics with related to the clinical practice and all activities as a doctor. And our registration is being monitored by the registration council of each state. So likewise, this is being monitored exclusively by another board. There also is an independent board. So likewise, three boards are being constituted, which fulfills almost all the activities of the recognition, approval, education of homeopathy in India. So, apart from the CCH, all the activities have been confined as well as diverged and put under the umbrella of NCH with a strong independent in these areas. Now, our discipline of discussion, what we want to tell about is the standardization of education in homeopathy. Most of the doctors who had through different homeopathic medical colleges used to compare ourselves with other doctors also in other disciplines. Where is the lacking? We very well knows. And who is at fault? It is not clear actually. Either the policymakers, either the colleges, either the teachers or the students. Where lies the fault? We are not looking into that. But actually, it is high time that we want to look into that area very seriously, because now it is comparable that I have studied about 40 years back. At that time, my exposure in clinical practice, I used to sit with many senior doctors. If any serious or any chronic illness is coming, these doctors will call us. We will discuss it. They will ask us to, you go and repertorize this case and come back. So we will repertorize the case. And at that time, there is no computer repertorization. We will simply draw lines and write the symptoms, and markings we will write and add it. And at least 30, 40 minutes we will take to repertorize a case. If now, after an analysis and evaluation, it makes only 10 minutes for a repertorization. At that time, during that time, if a delivery happens in the nearby hospital, there will be an information from that hospital to our college that the final year students or internees can come there. We used to go to that allopathy hospital and used to see the cases, and also used to attend the cases. Any one or two persons can attend the case also. So we were exposed to that. And in our hospital itself, there were good surgical clinic also was there. It was almost all the ID cases, everything is being done there. I want to introspect whether these facilities are exposed to our students now or not. I think I must tell that it is not being properly given to our students. Our students are not strangers. We are developed through one homeopathic college with the full support of our teachers, and we become practice. I think most of the doctors sitting in front of me are good doctors, developed with homeopathy, with their own effort, and living with homeopathy with a very good status in the society. Not a second-class practitioners or not a second-class personalities. We developed with this system, and this system can develop each doctor to the highest level. Then who has to do that? The colleges has to change that approach, and in many areas we have to improve. This I used to tell in most of the meetings and in all the forums. Where lies the fault? It is the fault of the system. We cannot simply tell it as the system fault and we will simply suffer. It is not the issue. We have to change ourselves, and we have to change our colleges. We have to change our teachers, and how the faculties can come forward with the proper orientation of clinical practice to our students. Immediately after completion of the course, they are full-fledged doctors. Whatever is the case, you see, now there is a trend in almost all the chronic conditions that homeopathy is best. And I want to stress once again that homeopathy is faced, is known as the most important holistic system of medicine, and homeopathy has got answer for almost all the chronic conditions. This is the belief of the public. Public got this appraisal, and we are the person to keep it, and accordingly we want to develop also. We want to develop means, as I told, we people might have developed, means almost all the people are of middle-aged people. We have developed through our continuous effort and clinical practice. We could manage some patients. But those who are coming out, the budding homeopathic doctors, who will take care of them? We should take care of them, and our clinics, we should give space to the newly coming out doctors to see the cases, and exactly in the same manner, the colleges should open areas for clinical practice extensively for these young students or doctors, because most of the colleges are having admission of 60 students or maybe of 100 students. And in a college, minimum 24 teaching faculties are there. If the admission capacity is 50, and 28 teaching faculties are there if the admission capacity is 100. And apart from that, we are posting guest faculties in different subjects, and teachers of modern medicine also are being engaged. It is effectively being done. They are coming, they are taking the classes. But I must tell one thing, in most of the colleges, these teachers are engaged in clinical practice only to minimum level. They attend 2 or 3 hours and they may go, or they will go to classrooms. That means the clinical exposure to the students are not properly shared. And at last, what happens, whenever these students are coming out from the colleges and keeping a clinic and starting seeing a patient, they are purely insecure, and with a loss of confidence they are sitting. If a fever case is coming, these doctors are looking for patent drugs only. I know most of the patient doctors are having at least 10 medicines for fever in their clinic. No, whether it is a bryonia case, or it is a nexomica case, or it is a gelsemium or eupatorium or rustox or whatever it is, to differentiate that itself, they are confused. Immediately they will take up one patent. Patient is happy, doctor is very happy. Eh? This is being practiced by our young doctors. Now, why this happens? And they are getting money, they are getting consultation fee, and the name of homeopathy is being spoiled by them. I must tell you. Because homeopathy, when prescribed, they can very well understand by the patient seeing themselves This can be well cured by our stocks. Such a confidence should come from the patient's mind, the doctor's mind itself. That is not coming. That is due to the lack of awareness of lack of clinical practice. It is clearly written the materia medica, every symptoms are there, therapeutics are there, but they are not confident. Why they are not seeing it? And likewise, many cases of cancer conditions, they are fearful. They tell to the patient, you do the treatment wherever you want. You go to that hospital, this hospital, likewise, wherever big oncologists are there. They are scared to treat the patients. And likewise, another condition I used to see with our doctors are to treat the psychiatric conditions. Some of my colleagues might be knowing I was looking after the psychiatric patients in National Homeopathy Research Institute in mental health. And I am confident to treat most of the cases only because of the continuous exposure to that clinical practice. And our doctors should get conversed one way or other how to treat the psychiatric cases. It is very interesting to study the psychology of the patients, and very interesting to study the premorbid personalities of the psychiatric patients. We will definitely get the etiological factors or premorbid characters, and the premorbid personality is the it will be well informed during case taking, and that premorbid personality itself will drive us towards the medicine. So that sort of education should be imparted to the students. And if such impartation, if such knowledge is being shared with the students, they will definitely flare up with systematic homeopathic treatment. They can very well improve. This is not being happened. That is the main and important issue we are facing in homeopathic education. And regarding the final year and third year students, final and third year, and is, I must tell that bedside education is not properly done in most of the colleges. And being the president of medical assessment board of a national commission for homeopathy, I must tell that we have noticed in many colleges that the college teachers are coming to the colleges, attending to the classes, and they may not be in the afternoon. They may not be in the college. They will leave the college. So likewise, many sort of issues are there. So what I want to highlight is that even if the teachers are sparing their full time in the OPD, it is not sufficient for the children to learn. And bedside education is the best way to be done. And all the teachers, even if they are an anatomy teacher or physiology teacher or surgery teacher or midwifery, whatever is the subject, all these teachers should be given OPD, and that OPD should be utilized by the students. One or other OPD will benefit in one. Only one case need to be seen on one day. So that also is being lacking in many of the homeopathic medical colleges. How this can be changed? Only rules and regulations cannot make changes. I must tell that colleges has to improve themselves, and National Commission for Homeopathy and many government also is giving all support for improvement of the homeopathic education. For improvement of a homeopathic education, National Commission has constituted these sort of facilities. Now, how it can be? It can be properly given to the students. That we have to think, and the non-clinical teachers has to come forward, and education in case taking, repertorization should be there, and complete students should spare the hospital after the classroom studies. They will be having limited classes sometimes, but OPD should be improved. How an OPD can be improved? That is another question, because I used to see many colleges and college authorities, including principals and professors also. Then I used to tell, you just give the hospital to improve for 6 months. We will develop it. Because we will very well aware that hospital can be improved through a community oriented program. And if good minded doctors are starting regular medical camps, school health programs, or other peripheral OPDs, or specialized clinics, or research programs in specialized programs, specified diseases. These activities will definitely give an impact in the society, and it will improve the name of the homeopathic medical college, and it will definitely highlight this is a very good hospital for psychiatric disorders. You just open a clinic for psychiatry, you just open a specialized clinic for dentistry or rheumatoid diseases, or some other gastrointestinal problem. Take it as a challenge, take it as a special project, and concentrate. 2 or 3 doctors may be engaged in that particular group. And to the community, we have to uh, uh, strongly come into the community by making medical camps. For example, now COVID programs are there. People are afraid to treat COVID, and our doctors themselves are fearful whether I may get COVID or not, and they are fearful to treat the COVID case also. They themselves suggest you go and take the vaccination. eh, it may cause problems. So likewise, loss of confidence is a very important problem. Why? Because they are not exposed to that, and the social factors or social positions are given more importance. And I think most of the doctors who are doing good practice in homeopathy were having very good number of COVID cases also, and almost 100% of post-COVID cases are well responded to homeopathic medicines also, and very well sure. Many cases under allopathic medicines are getting into cardiac complaints, or cholecystitis, or regular abdominal complaints, or regular respiratory illnesses and breathing difficulty. All these symptoms are being kept with the persons who caught COVID-19 and treated with the modern medicine or other systems of medicine. Whereas in the case of homeopathy, we didn't have any after effects. And after COVID-19, means COVID-19 will be relieved after 4 or 5 days. He is okay. And the convalescence and the post-COVID symptoms also will be relieved by another 1 week. This is the result of homeopathy. And I myself was experienced in so many cases. So that sort of, let's say, I told in the beginning itself, those who have got good practices should come forward to help these students, because young students are our power, our own children in homeopathy. So they should come forward to understand the cases, to learn the cases, and how can they themselves improve. And they have to see much and much cases, and that can be done through these 2 ways only. In the college should take the patronage of the students. They should give enough facility for clinical practice. And if it is being taken as a challenge, definitely hospital OPD will be improving, and hospital IPD will be improving. In most of the homeopathic medical colleges, I have seen that IPD of the hospital is very scarce. Maybe 5 patients are there, 10 patients are there. It is a very, very strange and shameful incident. Whereas in government homeopathic hospitals of Kerala, in most of the hospitals, enough number of patients are there and they are getting the benefits and they are giving name and fame to homeopathy. And people are rushing to homeopathy. And in many of the hospitals, from morning to 3 o'clock, uh, 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 much a rush of patients are there in Kerala. It is not being seen. Another defect of this lack of confidence is that the students after passing homeopathy want to go to allopathic hospitals to work as resident medical officers or night duty doctors or some other means to fulfill the stopgap. And this will cause a very great damage to the system. Later on, when their duty as a resident medical officer is over, they will come back to homeopathy and they will be unable to treat homeopathic uh, uh, homeopathy also. So they can treat only allopathy, and they will become somewhat what we call fake homeopaths. So this is also a uh, uh, this is also something going to happen in near future. In Maharashtra, university has approved a short-term course to practice modern medicine also. So National Commission has not agreed so far and not taken any decision. This issue has come and it is informed to ministry also for further proceedings. So likewise, so many things are there in our systems. We ourselves are in a very budding stage. We are having only this much a year, so only 230 years are there for this homeopathy system in total. So our system has to develop means it has to develop in a standard manner. With the Ayurveda or with the modern medicine, we have to improve. The improvement should first start in the education. As everybody knows, our educational system curriculum is equal to modern medicine and Ayurveda, and we are having our own therapeutics, materia medica, and organon apart from those systems of medicine. And that is right. But whether this is being properly utilized or that is being properly taught in the homeopathic medical colleges, that we want to examine once again. And I must tell that the uniform educational pattern has to be implemented in our homeopathic medical colleges. In case of MBBS, whatever is there, it is the same is being taught, but uh, I'm sure that it is not properly done, and the clinical practice is not being properly imparted. And if the clinical side is not given, there is no use in textbook education also. And so, in case of BHMS also, and case of MD homeopathy in different subjects, we have started and we want to impart more PG education in our system. It is highly required because the people are looking for more clinically oriented courses. Pediatrics, pediatrics is there, psychiatry is there, then medicine is there. So likewise, in the case of all the other branches of medicine, we have to start PG courses, and likewise in specialized subjects, we want to start more PhD education also. So in these areas, our National Commission has started working on it, and modification of regulations, etc., is being considered. So major changes we can expect in due course of time with regard to the policy making and implementation of policy, etc. But however, a root changes should happen from the colleges themselves. And if we want to modify and want to manipulate something or misrepresent something, everything is easy with the colleges also. So they should come forward with a broad-minded attitude that well, our students should be the best of the country. With that motive, we have to, because many of the colleges are there now. They are working with the NABH or NAC accreditation and implementing advanced facilities in the laboratories. And now I think most of the laboratories of our colleges are not well maintained. And when we are examining the available facilities of the colleges, it is noticed that only minimum facilities are there. Even though standard has been formulated for the laboratory facilities, the colleges are not giving the proper facility in many of the colleges. But there are colleges with maximum facilities, and the students coming out of from that colleges, they are more confident. So wherever the students are studying, everything should be available. The laboratory facility, all the uh, available facilities, all the facilities should be made available, and they should be trained in that, and that will improve the system also. So that sort of an attitude is essential. And I want to highlight once again the clinical as well as preclinical and practical and the community-based activities. Everything should be well oriented to the students, or else our system will fail, and the system has failed to a major extent. And due to the efficacy of this holistic system of medicine, still now we are standing and we are keeping the name of homeopathy in the higher level itself. And this being approved by the modern scientists. And now, apart from the homeopathic fraternity, modern scientists have come forward for taking up fundamental studies, so that we have to prove ourselves the action of homeopathic medicines in different potencies and in what all conditions it is acting in nano particles. So these sort of studies have been taken up. As I accepted that we are in the infantile stage, now we have got all the other facilities. Our colleges should take up such studies. And I'm very well sure that our homeopathic medical colleges have not taken up research oriented programs. Only in PG colleges, research oriented programs are there, but I'm, I cannot tell that their research are very highly. It is done in a very good manner. It has to be improved. Our teachers has to give good training for those things, and research has to be implemented in a very good manner. And the colleges are the best platform to implement research in various clinical as well as non-clinical areas. We had a discussion in the Ministry of Ayush regarding the same subject, because modern medicine doctors don't know about the Ayurveda, homeopathy, and all, and homeopathic doctors don't know about Ayurveda and other systems. Ayurveda doctors also don't know other systems. So, in all these systems of medicine, there will be a certain awareness for the other systems of medicine that is being discussed, and in very short time that will be implemented. Because Ayurveda people can study homeopathy, they cannot practice. Homeopathy people can study Ayurveda, because we are the persons to answer to the public. So we will be made aware about the significance of Ayurveda and nature of work of Ayurveda also. That will be coming soon. For concluding, I must tell thanks to all of you for giving an opportunity to share my ideas with you. Thank you very much.